Diabetes is a condition where the pancreas doesn't produce or have a defect in producing insulin, which is the protein that metabolizes glucose when you eat. The main symptoms of diabetes are thirst, increased urinary frequency or volume. People tend to urinate more, therefore they become more thirsty, and also blurry vision or increased appetite. Diabetes, who's at risk of getting diabetes? Diabetes is a condition that we call multifactorial. There's a genetic component, and there's also an environmental component, which is a lifestyle component. People that are at risk of getting diabetes, we have seen that there's an increased risk in the Hispanic and Afro-American populations. That's from a genetic component. Also, people that tend to have lifestyles of eating fast food or not eating a healthy diet can also have a high risk of developing diabetes, even though they don't have the genetic component. When a patient is having symptoms from the diabetes, which requires hospitalization, these symptoms usually are nausea, vomiting, changes in mental status. And people, when they have nausea and vomiting, they cannot tolerate anything by mouth, and that also sometimes they don't tolerate their medication, so their sugar goes high, is elevated, and that's when they require coming to the hospital so they can get hydration because of the dehydration from not eating anything, and also medication by injections to control the blood sugars. If the blood sugar is too high, then they might require insulin to be given by IV continuously to control the sugar. Diabetes usually expresses herself in two types: diabetes type 1 and diabetes type 2. Diabetes type 1, we usually see it in younger people. It means it starts in childhood. It's when it's considered an autoimmune disease, when the own body starts attacking the pancreas, and the pancreas cannot produce insulin the way that it should to control the glucose from going too high. The diabetes type 2 is more of an adult type of disease, when, because of genetic modifications or lifestyle issues, the patient insulin doesn't work properly, and it cannot digest insulin glucose the way it should, and then you see that the glucose level is elevated.